Hi everyone, welcome to See the Invisible, living with an invisible or rare disease. My name is Rhonda Franny Jefferson, and thank you so much for taking some time out to listen. If you are watching by video, you probably can see that I'm in a little bit of a different setting. I'm not feeling as great today, so I have my legs elevated, so the camera will actually be a lot closer than it is normally because of the way I needed to set it up. But if you're new to this podcast, then welcome. Just to let you know a little bit about myself and why I started this podcast. I do have both an invisible and a rare illness. I was diagnosed about 7.5 going on 8 years ago, and between the struggles physically, struggles emotionally, and now with adding coronavirus on top of that, along with some of social media interactions, I felt that things were very negative and that I really wanted to try to be more positive about things. While some of those interactions upset me, I wanted to use my energy towards something that I found productive. And this podcast really does help. It's therapeutic for me as well. Plus, I'm learning a lot of new things too. Also, I know that there are so many different types of illnesses and that everybody's situation is different. So I always want to be as respectful as possible. But, there may be times where, something that I'm covering may not be applicable to a certain illness. But even if so, there's usually at least one takeaway from the podcast or video, even if it's just to take a little bit of time out, for yourself and not have to worry about doing the dishes or paying the bills, just to sit down for a few minutes and listen to something else. So, just to tell you a little bit about this past week, I did mention last week that I was going to see an immunologist and allergist regarding whether or not I should get the COVID vaccine. And so we discussed a few things. He actually cleared me to get the flu shot, which none of my previous doctors had, but he said that there were some changes that had been made and that, it was now, okay for me to get the flu vaccine. He also did say he thought it was very important that I do get the COVID vaccine. One of the most apt phrases I've heard regarding whether or not to get the vaccine is, he said that COVID-19 was a freight train that was running down a track, and they needed to get me out of the way of the freight train. And it just so happened that someone had canceled their appointment that day, and they did have a couple of doses that, because I know the vaccine can only be out for so long, it was probably not going to be able to be used. That was in his other office because he has multiple locations. So he let them know that I would be coming in today to that office, and I was able to get my COVID vaccine. Also, on the same day, my husband got a call that he was able to get his vaccine. And then later on, I was able to get my dad in to get the vaccine on a Saturday. So it just happened to work out because we had been trying, to look into that, and it just kind of fell into place. The only negative on my end is he said it could lead to a flare-up of my autoinflammatory disease. That to have the vaccine be optimal, I cannot take some of the medications that I normally have to take. So he said that if I could bear the flare-up, he would prefer for me not to take those medications. Also, really the main or biggest medication that I have, which is an infusion, we're going to have to push that back by at least a week because of how the timing falls. But I was really happy though. It's a relief. And while I know that things probably will not be back to what we would call our old normal again for a very long time, if at all, it hopefully will give my family and I some sense of normalcy. And this weekend too was Easter dinner. My brother and sister-in-law couldn't come. We had been planning on having them over with their kids, and unfortunately one of my nephews started to get sick, and they really weren't sure what was going on, and they didn't want to come over and take that chance. It would have actually been the first time that they had been over in so long. I can't remember the last time my kids got to play with their cousins, and they were so excited too. So that was kind of rough, having to, explain to them that while they actually helped me fill the Easter eggs with candy, where they'd never done that before, where they were so excited to say, I'm sorry, honeys, they're not going to be able to make it this time. But I think overall they were pretty understanding about that. Easter dinner, though, I didn't cook as much as I normally would. I knew we would have fewer people anyway. So it was my dad, my sister, my brother-in-law, and my nephew. My nephew's actually about my age, and he has had COVID, and he actually had a stroke shortly after recovering from COVID. So it was very, very good to get to see him, because I hadn't seen him in person either. I think since the actual pandemic began. So, it was really good to see him up and around. He's gone back to work, so that was a relief too, to see just how well he was doing when things could have been much, much worse. So very thankful for that. I do have to realize when I'm overdoing things though, because, first of all, so far, knock on wood, I've done really well with the vaccine, and any side effects, just some soreness in my arm. And then it just seems like there's a certain time at night where there's like a finger snap and I have to go to sleep just like that, which actually I will take, because a lot of times I have a hard time going to sleep. So that's actually pretty good for me. I think I did try to cook a few too many things, but I actually knew when to step back, such as I wanted to do a cake, cupcakes, and cookies. I got to a point where I was like, no, I can't do that. I was going to make an extra side dish. I'm like, nope, can't do that either. It was just really taking a lot out of me in order to do any of that. So I'm glad I had those realizations of when I really needed to take a step back and decide not to do something. Probably the, I don't want to say stupidest, least attentive maybe thing that I did this weekend, besides accidentally dumping hot water on my hand, was I was going to make an Easter basket cake. And I have different cake pans that have different shapes, and I went to reach for one, didn't bother to turn it around. Just from the upside or looking down in, I thought it was the basket. So I went ahead and baked the cake, and it was actually a Care Bear cake. So I kind of turned it upside down and made a rabbit's face out of the bottom part of the Care Bear. Maybe not the greatest cake in the world, but considering the other alternative was to try to make a Care Bear and put a basket in the middle of them in a very small space, I figured Easter Bunny was the best bet. So that's a little bit about my week. I hope everybody had the best week possible. If you do celebrate Easter, happy Easter. So, before I start any episode, but especially more with this episode, I want to emphasize that I am not a medical, legal, or insurance expert, And I think for this particular episode or series of episodes, I'll even add in technical expert. What I've been doing is gathering information from online and using real life examples and situations, as well as my personal experiences to bring together some information. The information may or may not reflect my personal beliefs, but I want to maintain an open environment and keep personal opinion out of factual data so that everyone can make their decisions when consulting on a medical or with a medical expert about what may be best for your situation. So what I mean by that is, if I'm referring to something that is a study and there's very hard and fast numbers, I don't want to interject my personal beliefs as to whether or not I believe those numbers. If there are studies done and those are their numbers, those are those numbers. What I may say is if my situation kind of fell outside that realm, then I'll go ahead and, give my situation. But, if you are new here, you will learn that, I really emphasize that I understand that everybody's situation is different. So, I understand that how I feel about something is not going to be exactly what the next person feels. And one of the reasons that that's important for this episode is over the next few episodes, I'll be looking at healthcare apps, and there are a lot of different types of apps and how they can be used. So, when one person may have a really good experience with an app, someone else might not. That's why I also brought up the technical part, as far as the fact that I'm not an expert in that field either. But when working with apps, they do need to be user-friendly. So I can always bring that aspect into it. So when I say health tracking apps, what do you really think of? I think a lot of people, when they first hear that, they think of the, I don't want to say a name brand here, but say those bracelets that you wear that can track your heart rate, steps that you take, things like that. And there are so many different apps that work together with those, even if it's just manual tracking, where once you get that number off the bracelet or the watch, you can just go ahead and plug those numbers into a certain app. You can keep track of how much water you drink, how much caffeine you drink if you're trying to cut down on that, how much you sleep. And there's just innumerable aspects of your day that these types of both apps and tracking devices can actually provide. But when someone has a chronic illness, you may need one or more of those apps or devices for your condition, and you may need to learn to rely on them for some parts of your day or a lot of aspects. So, they can have a profound effect on how we manage our daily lives. Even outside the realms of health apps, I found technology that can help me in my daily life. Sometimes I have trouble remembering things. That's a little bit more than just, that overall fog that everybody gets as they get a little bit older. So I use Alexa to help me make lists or remind me of things when I know that most likely I'll forget, even if it's something really simple. But things are kind of advancing very quickly as far as technology goes, and things are really able to work together almost seamlessly in some cases. So, that's just one device that I use outside of something that's labeled a health app, but it is still something that's helping me with my particular issues in regards to my illness, as well as I can even use it towards my health goals, such as tracking when my next appointments are, have I taken my morning medicine for the day, things like that, reminding myself to get a refill. So even other apps outside of those realms of the label fitness or health, we might be able to use them to help manage our daily lives. There are some apps out there that have a more general view on things, and some are very specific to a certain illness. One of the first things I think about there are the apps that are connected to the device that can control your, or that keeps measuring your blood sugar. I do have quite a few people in my family who have diabetes. Some, are looking into getting that device, as well as having a family member who has the insulin pump. So, those types of technologies are very important to my family. So, of course, knowing how important those things are, blood sugar is something that's extremely serious and has to be tracked quite closely. So what would the impact of those apps have? Specifically in regards to that example, that'll probably be on episode 2, because I do know that this will be at least a 2-part episode. You really need to understand how those different apps help both manage in our daily lives, as well as give us a better handle on our particular illness. So, let's see. There are also very many apps out there that help with mental health. And since there is a whole category of apps that help in that category, I'm going to also review them on a separate episode as well. But there's such a wide range of tech out there, some of which is wearable, some is standalone. I'm just going to refer to anything, whether it's I can't say that word today, wearable, completely mobile, or somehow they interface with each other. I'm just going to call all of that tech. I do want to make some distinctions, though. We've already kind of talked about more of the fitness or step tracking type of apps. Now, they may say they track things like heart rate, maybe oxygen levels, and while they may be used in conjunction with a specific health app, most of all, when it's just a strictly fitness app, it tends to be looking at a specific goal, such as losing weight, gaining muscle mass, not necessarily about focusing on an illness. Now, it can actually help get a better handle or understanding of your particular illness, but it's not actually made or developed for that. So overall, most apps can have pros and cons fall into some specific categories, whether it's specifically towards one illness, if it's more of a wider range app for those who have illnesses, or even if it's one that's just used by everybody to help track certain things. The pros of those are, of course, the convenience. Before having some of these apps, if we wanted to check our blood pressure or heart rate, we would either have to have a whole separate machine or just wait until we got to our doctor. Or sometimes if you went to a pharmacist, there would be a machine there where you could check it. But now, nearly 2/3 of Americans have a smartphone. So I really think that some of those numbers may have even increased over this past year, just because people have had to become more reliant on apps and kind of the internet and mobile technology in general. So there's a lot more that's just right there for us to use, whereas 20 years ago we probably wouldn't have even thought that. Most of the apps that are out there are pretty reasonably priced, if they cost anything at all. I was looking at some today, and while they were technically free, to access any of the more upgraded or advanced parts of the app, you would have to pay for a different version, or even if it didn't give that option, you would have to watch about 20 videos in a 10-minute time frame just to get through everything that you needed to do. So they are convenient as far as being available when we need them to, but of course there are a couple downsides to that. having an app as well can encourage or promote healthy behavior because you have something there always reminding you what to do. So if your goal is you think that you need to take so many steps per day to help with your cardiovascular health, and you set that goal, having that on your phone or your smart device, and it reminds you halfway through the day that you're not halfway through your goal, that will kind of give you motivation to try to get that goal completed. You can see other things, such as if you have high blood pressure, you may be able to check that. And it gives you a better understanding of exactly where you fall in regards to either improving your health or where you want to be. A lot of times apps too can be educational. I know a lot of apps, they are kind of all inclusive. You can search for information about a certain topic, all while within one app. So you actually end up learning a little bit more either about a particular illness or a particular symptom that you're exhibiting. And some even will allow you to have access to different types of medical articles. So that's always important too, to keep up to date if things are changing. Now, of course, always on the plus side of something, there's always the cons. So I think in any type of technological field, one of the first concerns always is your privacy. We're always hearing about certain data privacy breaches where somebody's hacked in and either they come away with something as small as an email address to things such as personal identifiable information that focuses on you. So is it something as little as your email address, or is it something that gives things such as a maiden name, a date of birth, even part of your social security number or a credit card number? That's very important in this day and age, and a lot of people can very easily try to get into any of those. So we have to be careful ourselves as to whether or not we trust a certain app that we're downloading, or whether or not we're entering information into an app that we trust. A study did find that paid apps did have less of a risk to your privacy because they did not have to rely on advertisers to make money. That doesn't necessarily mean that anybody who creates an app that has a lot of ads on there, it doesn't mean they were particularly creating it to get some of your information. It could also be then that they are reliant on advertisers, and that means there's more users and more access to those apps for someone else to be able to come in and get the information. Now, in the part under the pros, I was talking about how it's nice to have that convenience. You can check heart rate, things like that at home. But these apps are not always the best as far as accuracy. I'll give you an example. With my old smartphone, the fingerprint sensor never worked. It was, well, it's not exaggerating to say it never worked. I got a new phone. It was a replacement phone near the end of last year. And actually, the fingerprint worked pretty good. If not, the biometric for facial feature recognition worked just as well. But I had to turn that phone back in because it wasn't actually compatible with my network, even though both my network and the maker of the phone said it would be. So I actually had to take a few steps down as far as the phone that I was using, or at least two where I wanted to be with the phone. So it did have biometrics. I find biometrics very useful, as I do have sometimes issues with my dexterity. It's easier for me to just be able to put a fingerprint on there, or lean it up or tilt it up to my face to get the facial recognition. And like I said, the one that I originally got as the replacement worked great. This one definitely does not work that well at all. It will take your fingerprint one time and then never accept it again. And I've tried it with and without a screen guard, adjusting the sensitivity. There's even YouTube videos out there for this particular phone on how to try to bypass or get past that fingerprint issue, so it's a known issue. Also with the facial features, when I went to add the face, it gave a couple suggestions, such as if you occasionally wear glasses, make sure you're wearing those, and you can take 2 different facial pictures. But at least 2/3 of the time, it tells me that my face doesn't match. And yes, I am excluding those times where I'm accidentally trying to, open my phone while I still have a mask on. But 90% of the time, I don't have a mask on because I'm within the house. And most of the time, though, it still tells me that my facial features were not recognized. So if it's telling me that on things that are very, very basic and very, very objective, a fingerprint is your fingerprint, my face is my face, but it's telling me that it can't recognize that, it makes me really wonder, is it going to recognize my oxygen level, my heart rate? Is it really going to recognize those numbers accurately, or is it going to provide false information to me, which could either cause me to panic, thinking that my blood pressure is up extremely high, or will it be telling me something where I think everything's good, that my blood pressure, heart rate, sugar, whatever it is I happen to be checking is good, when in fact it is not. Let's see. There were, again, some reviews of most of these apps, and most of the apps will have a warning on there saying that they are for recreational use only. In other words, they're not intended to help specifically with diagnosis or tracking or anything like that. It's just meant for, in regards to what they say is recreational use, it's kind of like how something will say it's for entertainment purposes. That means it's not really working the way that we as the consumer hope or expect for it to work. And kind of along the same lines of that is there is actually very few actual health apps out there that really have any oversight. There was a study put on by the Journal of the American Society of Hypertension. So this is specifically about blood pressure. And out of 107 apps that they reviewed for hypertension, so these apps use the term either hypertension or high blood pressure. Out of those 107 apps, 3% were actually created by healthcare agencies or organizations. Absolutely none of the apps had been approved by the FDA. But if you look at what the description said, it would say that 14% of those medical devices could be turned into a blood pressure machine. So that's kind of scary that, those numbers are telling us that, really these apps are not being monitored or controlled in any way, where the protection for the consumer is not there. If a vitamin comes out, that has to be approved by the FDA. But something that many more people may be using, it's fallible. It's not under any type of oversight. And so these past 2 things that I just went over were really very, very surprising to me. One of the reasons why is, up until the middle of last year, there was no FDA-approved treatment for my illness. Now, going back and reviewing some things this past week, there's not even a definitive date as to when my particular illness was first diagnosed. The man credited with diagnosing or isolating the disease died in 1941. And just if I kind of take a look at his age and think, maybe he was in middle age, When he made I don't want to say discovery, but was able to isolate this illness, then that would probably put it between 1900 and 1920. And he diagnosed the juvenile version, and then in the 1970s, the adult version was diagnosed. But even with all of those years and knowing, even prior to the adult version, that, the juvenile one is pretty much the same thing. It's just a matter of when it was diagnosed or first onset. There was no FDA approved treatment for then over 40 years. And the treatment that we have now is something that's already being used for another illness. And, it may or may not affect every person with my illness in the same way. So what happens is insurance will not cover some of those medications because they're not FDA approved. Yet, apps out there that are touting themselves as health apps, helping you live a healthier lifestyle, and some that are developed specifically for one illness or another, don't have any oversight. And you would hope that the manufacturers or creators, have a sense of obligation and try their best to make sure that, the apps that they're putting out are as accurate as possible. We never really know. We just see a name or a creator or a company, and we put our faith blindly into that company. Even if you do a little bit of research, there's no guarantee that that research is 100% accurate as well, because, I've actually received something in the mail for an over-the-counter medication that I bought through Amazon, and I got a postcard saying if you go in and give us a 5-star review, then we'll give you some free product. And I'm like, no, because I don't think it deserved a 5-star review, and I'm not going to skew the results. But it makes me wonder how many reviews on any site are actually being impacted by those types of cards. And it's not the first time I've received something similar, but it makes me think about any type of review that I read, whether or not it's actually, beneficial, or whether it's accurate. Just kind of a side note, and this is something that I heard a very long time ago, that if you have an app that's rated like consistently 5 out of 5 all the time, if it's like a 4.8 or 4.9 rating, then you might want to be a little leery of it because of, one, the promotion that I was just mentioning, when you can get free product, or it's actually, staff members from the company going in and leaving reviews. Is it for every app that has a high rating? No. It's just remember to be cautious. Even if you see something has a 5-star rating, still approach it with caution. So these were, some of the pros and cons for a lot of the different types of health apps, health tech that we have now. I'm just going to start briefly before I end for the day about what we'll be looking at next week, and what I'm considering basic charting or patient portals. That's a whole section in and of itself. So these are electronic health records, which are great if another physician in that network has access to your electronic health record. It cuts down on risks. If you're not with your original doctor, or if you're taken to the hospital because of an emergency, someone else there will have access to your health record and be able to provide better care, because you may not always be able to provide the information that they're asking, but your health record should be able to do so. Then there's also a personalized medical record or health record, depending on how you want to refer to it. But these are records where you keep track of your information, so it could just be literally a pile of papers where you have listings of all your medications, all of your recent test results that you're keeping separately yourself. That's something you personally are taking charge of. And so even though it's not an app per se, it is technology. Most of the patient portals do have an app that go along with them. So, like my hospital, you can download or review the portal through their website, but they also have an app that you can download. So those are types of apps that are beneficial in keeping all of your basic but pertinent information in one place. You can keep track of appointments, medication, things like that within the app. And I admit, when I'm going to a new doctor and I need to take a list of all my medications, I will just usually print out that page because it normally has some information on it there. Also, the patient portals, at least the one that my hospital uses, will have copies of notes or discharge summaries so that if you need to refer back to one, it's there. So that's your personalized health or medical record. And a lot of times the EHR or electronic works hand in hand with the personal, because with the electronic health record, your doctor may not be in the same network as who you see in an emergency especially. And even though my primary specialist is not in network for most of the hospitals around here, that she still does have to work with those hospitals because those are the hospitals that run tests on our patients. Doctors there refer themselves or refer their patients to her. So just as far as basic access, though, she uses a whole different patient portal than what I use from my primary doctor, my pulmonologist, and a couple of other doctors that I use. So it's important to recognize that not every doctor that you see may be within the network of that particular electronic health record. So make sure that you have information with you as well. Now, I don't want to make this an incredibly long video like last week's hour-long marathon. So I'm going to stop here today, and I'm going to break down some of the percentages for these types of apps as far as, say, patient trust in the apps, whether or not they think or people think overall that they're affecting our healthcare in either a good or bad way, and just review the pros and cons of that as well. So there are a few other different categories that I'll be looking at as well. Let me see. Just bear with me just a moment. So like, for example, one would be healthcare providers can use certain things to track our health, to make sure we're staying in compliance with our treatment plan. Even though, like, for example, a Holter monitor or things like that may not be sent back to a healthcare provider immediately, there are some types of tech that can be worn where your healthcare provider can get that information and you can meet more often about that. It will be an improvement on the monitoring between you and your doctor and making sure that you're doing the best together to take care of your illness. Taking a more in-depth view at the lack of regulation in regards to some of these apps, and a look at if we're becoming too reliant on these apps, which may not even just be about health apps, but things in general. So, as always, any of the sources that I used, I'll go ahead and put them into the description or body of the description of the podcast, or if you're on YouTube, in the description of the video. Hopefully I'll be feeling a little bit better next week. Fingers crossed. And so, again, thank you all for tuning in to listen today. It really means a lot to me to be able to talk about my experiences. And, like I said earlier, I'm also learning a lot of things as well. So I look forward to talking to all of you next week. Please make sure that you're taking care of yourselves, following all protocols, and just, again, thank you very much for tuning in, and I will talk to you next week. Bye-bye.